It's 5:03, and the Affordable Housing Special Committee meeting will come to order. I will go ahead and read the motion for the electronic meeting. Pursuant to Governor's Lee's Executive Order number 65 regarding electronic meetings, I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council, and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak. Can I have a motion, please? Someone please move. Thank you. Second? All right, thank you. Since we're not taking any vote on any bill at this meeting, so I'll just vote by acclamation or by voice vote. All those in favor of that motion, please say aye. Aye. Thank you. Any opposition? Any abstention? Thank you. The ayes have it. So when we first decided to do this special call meeting, we were going to look into Bill 2024-56, and we wanted to have the opportunity to talk some more about it and to give ourselves a lot of time to discuss the substitute bill that is attached to the ordinance. As of this afternoon, I was not able to get the substitute bill sent to all of you for us to look at, and so we would not be taking that up. We will be having our regular Affordable Housing Committee meeting on Monday, and we do have more than 15 minutes, so I've looked at the schedule. We will be after Budget and Finance, so that will give us enough time to actually discuss the ordinance as well as the substitute. So that works out okay. In the meantime, I asked Ms. Judy Tackett to come to the meeting. I wasn't sure how much time we'll be able to give her, but I'm glad that now we actually have more time. Many of you have been receiving emails about the encampment. There's a lot of issues getting cold, and I felt like this is an issue that cannot wait any longer, and we wanted to know what the administration is doing and what are the efforts that are going on relates to our homeless population in Nashville. So we have Miss Judy Tackett with us. I believe we have Miss Davis and Miss Dillashaw. I hope I pronounced that right. My apologies if I did not. And all three of them will be talking with us with what is going on, and then you all will have the opportunity to ask some questions. So, Ms. Tackett, I will hand it over to you at this point.
Thank you so much. So I'm going to start my video, but I also will ask for the presenters ball, so I can actually show you a quick introduction, a presentation, and share my screen. So if you could let me know that you can see my screen, that would be fantastic. Can you all see my screen at this point?
It's like it's still loading.
Okay.
If you would excuse me for a second, Ms. Tackett. IT, we have a couple of council member, don't we, as attendees. Would you please move them to panelists, please? Thank you. And I think Buckley Allen is calling in from a cell phone number 498-3235. If she can be moved as a panelist as well, I appreciate that. Thank you.
I think it's up for me now, Judy. So hopefully for everybody.
Okay, great. So what I want to talk about real quickly, just give a quick overview of what we're doing, and then move through this swiftly so we can go into Q&A and actually focus on what you're interested in. So one of the things I just always want to state that we actually know how to end homelessness. It is affordable housing with appropriate services that are targeted and engage a person at their level with the right service intervention. And then also these services need to include looking at a person's income to sustain the housing long term. And income can mean a full-time job. It can mean a part-time job. It can mean also linking people to mainstream services like Social Security, food stamps, ongoing housing subsidies. Just the basic needs need to be met, and that's what we're talking about. It's something that all of you know, but we cannot stress it enough that while it seems simple, it is complicated to actually make all this happen. So next, here I want to talk specifically about what homelessness in Nashville looks like. And all of you by now have probably heard these numbers before. So during the last 10 days in January, the federal government requests communities conduct what is called a point-in-time count. And this point-in-time provides trends over several years. And it also looks at basic demographics. It is a snapshot, and it has limitations, but it also serves as an ongoing measure that, together with other data sources like homeless management information systems, also data, can shape a fuller picture of what homelessness looks like in our community. So what this slide shows you is that on the night of January 23, 2020, 2,016 people were counted as experiencing literal homelessness in Davidson County. Literal homelessness is what I'm focusing on in this conversation today. It includes people in sheltered situations, in emergency shelters, or in some transitional housing setups, and also in unsheltered situations. Sleeping on the streets, in encampments, in cars, and in other places not meant for human habitation. So one of the things when we look at literal homelessness, it really is the narrowest definition of homelessness. Over the past 4 years, so since 2016 to 2020, our overall count, that snapshot, has actually decreased by 15% in Nashville. Between 2019 and 2020, we have seen this more or less a stagnation. So that's kind of the situation where we went into COVID. So homelessness during COVID has become, as you all know, very complex. In April, Metro opened a shelter at the fairgrounds to assist the Nashville Rescue Mission with the implementation of social distancing policies, and also giving people that experience homelessness and are living in shelters the ability to force social distancing. And a separate building was then set up for people who showed COVID symptoms. And in that building, which is a very huge area also at the fairground, with input from the health department and with guidance from epidemiologists, there was a section set up for people who had tested positive but were not sick enough to remain in a hospital. In June, Metro then opened a second shelter for women at the municipal auditorium. And I have also looked very much at encampment responses. So in March, we pulled all outreach groups in the community together to work on establishing food drop-offs in encampments. The reason we focused on food was because it was the first time that I've ever done this work that I have seen people go hungry. COVID really has stopped abruptly some services and some assistance like food, where people can get food and access to food. It also changed and made homelessness more visible because libraries closed, waiting rooms, and I'm talking about doctors' waiting rooms, I'm talking about any type of services waiting rooms, I'm talking about when churches closed their services for people. It also included the assistance services and food services for people experiencing homelessness. And that impacted that people not only didn't have places to go and stay and hang out, but also lost a sense of community. So with that, you can imagine that just their effect on their mental health. When we are affected by mental health through COVID, their stress level went up. So that's kind of when we have seen increases in just behavioral issues, increases in overall just people not knowing where to go and desperation. And it's really been affecting all of us, but we've also seen a huge increase in complaints from neighborhoods, and as you have, and I know that because I've been in touch with most of you, if not all of you, about that. So the increases that we at the Homeless Impact Division have seen in complaints from July through September, and not just through the hub, but also directly to us from neighbors or through you or other departments, it's been 77% more complaints over last year. So it really has made a difference that we actually, can see and measure. But what are we doing right now? And that's kind of what I really wanted to get to, because when I have been talking to you all summer, I have been talking to you, here's what we're working on, but then it takes some time. Well, the last 3 months, and really since June, the federal government announced additional homelessness allocations in response to COVID through what is called a program called Emergency Solution Grants. We in Nashville received a one-time allocation of $10 million in ESG COVID grants. That money is from the Department of Housing and Urban Development to address literal homelessness. And it is locally administered by the Metropolitan Development and Housing Agency. Nashville also received technical assistance from the Department of Housing and Urban Development, and actually we received that since the tornado in March. By April, that assistance expanded to include COVID, and by June, our assigned consultant has been Heather Dillashaw from ICF. She's on the call today, and she will help answer some of your questions. I'm stressing the importance of this technical assistance and of this consulting because it is a huge change maker in our community and how we coordinate when we have this additional support from HUD coming in. And it helps us really set up these programs in a way that HUD wants to have them set up. We do it right. Let's put it that way. It takes a lot of guesswork out of it, and we really know that we're doing this right and using these dollars to increase the systems approach, the systems building that you have me heard talk about over the past few years. So once the MDHA knew that the money was coming, we at the Homeless Impact Division were brought in to help with the community coordination effort as well. So the ESG dollars are granted out to nonprofit organizations. There are about 15 recipients. About $800,000 went to street outreach programs, and most of the money, about $6.3 million, is going to what is called the rapid rehousing program. There are 3 core components of rapid rehousing, and they are 1, housing identification, 2, rent and moving assistance, and 3, the case management support. Housing ends homelessness. Without that, we cannot, homelessness is really a housing status, a housing description. So without housing, we cannot end homelessness. And now you've also heard me, and I hope you hear me say that very loud and clear. It's not just housing alone. We also need to bring in the right services. And it needs to be an individual approach, a person-centered approach with the services involved. So our goal with the Emergency Solution Grant is to house 400 plus people who experience literal homelessness by December 2021. Since July, we have held weekly meetings with providers that are interested in creating rapid rehousing programs. And this fall, we have started weekly rapid rehousing trainings that Heather Dillashaw has led for our community. And I also want to say that traditionally, our community has focused on and has had rapid rehousing programs, but we have focused on families, youth and young adults, and veterans. Yet when you look in the encampments, what you mostly see is individuals and couples without children. And also you see the majority of individuals or shelter population is also individuals. So we really have underserved the people that we see on the streets and in shelters. And that's this goal with housing 400 plus people really includes the very same individuals that you see on the streets and that all of us get complaints about. So we have identified a total of 6 organizations out of the 15 who are expanding their programs. And what I want to say is this is an opportunity to increase the base of services. These 6 organizations are either new to these type of programs, or they're just really expanding, and one of them is even new to Nashville and really expanding their horizons and their services. That's another opportunity that we're looking at. As of this week, and we really started, the money has been flowing basically since November, at the end of October, early November, and organizations are now building these programs. And we are in the second week of November and have already identified, and through a prioritization effort, 70 people, 70 households that are actively working with nonprofits towards housing. And we are prioritizing these households based on vulnerability, including looking at underlying health issues that make them at high risk if they contract COVID. A big part of this is that we are looking at a landlord engagement effort. We at the Homeless Impact Division are gonna be kind of the core gap filler. We're helping, and I have a dedicated staff member already that has been working with landlord engagement. We are expanding that, looking to add an additional staff member. I'm looking actually to maybe some of the other staff members that have done outreach really focus on the housing effort as well, because that's kind of what everything needs to be about right now to help people move in. We're looking at moving costs, rent assistance for up to 1 year through rapid rehousing, and then the case management also for up to 1 year to help people remain in housing after that year. The landlord engagement goal is to set clear housing goals for each organization. So each partner agency, there are weekly meetings where they set monthly housing goals. They look at where they are. They work together and collaborate. We have weekly coordination meetings to refer people for each organization. And that's part of one group of collaboration. Another group is the landlord engagement collaboration, where stakeholder groups are meeting every 2 weeks. And we are working with them to identify 2 types of lists. One is the list of motels. About 65 motels have been identified on that list as potentials to reach out. They have been housing people on a monthly basis. So what we're looking, ESG dollars can be used to pay for up to 1 year. Motels can serve as landlords if they're willing to enter a 1 year lease that with an option of renewal after that 1 year. And that's kind of the goal that we have. Ideally, a motel, each room has a kitchenette, but if they have a fridge and a microwave, that will be acceptable. And of course, a restroom that's separate, attached to it. And then that can be serving as a efficiency housing units. But again, the key is to enter into agreements with motels that are interested to participate so that they are willing to have a lease agreement with a renter for 1 year and with option to renewal after that. We're also secondly looking at a landlord list, just the more traditional landlords for apartments. And on both of those, the coordination that we have with these 15 partners is making sure that we don't step on each other's toes. So we really go through these lists. We look at who's already working with whom so that we don't overwhelm potential motels or landlords. And finally, we are also looking at creating landlord incentives. For example, we will be having a designated phone line for landlords, and we're looking at a mitigation fund that could pay for potential damages at the end if the lease is up, or just to assist landlords and giving some incentives for them to participate in our efforts. I'm now at the end of the presentation and want to open it up to Q&A. But before I do, I really want to go through what I have listed here as resources. One is we at the Homeless Impact Division, we have started to publish a monthly report for our Homelessness Planning Council. And they are very extensive and they are posted online. So you can see that a monthly report, I can send these links out to all of you. And actually, all of you are already on the monthly Continuum of Care newsletter, which has a link to this monthly report. So there is a lot of information that you can dig in a little bit deeper, also in terms of data and personal story and what that means. And then I know that there will be a lot of questions around cold weather approaches. And as every year, there is a website, coldweathernashville.com. On that website, you find all the information. You find the Metro Overflow Shelter Plan separately. And this is a website that really posts every year the Cold Weather Community Response Plan, which outlines the Nashville Rescue Mission, Room in the Inn, Launchpad, and other partners' winter responses as well. So I just want to end here with the presentation and just give it over so we can go into Q&A. And I will stop sharing the screen so I can actually see you as well.
Thank you. Council members, if you have questions, if you would please raise your WebEx hands. I'm looking. Let me start you off, Ms. Tackett. I know you talk about some of the programs that you want to do with the landlord and the housing. Has this started? Have we started moving individuals into this program? What is the time frame that we're looking at? I mean, the weather is getting colder. We get emails about encampment every day. And so this cannot be a long-range plan that will take a long time. So since the money is here, what have we done? What timeline are we looking at? Can you speak to that, either you or Ms. Dillashaw?
Yes, so 70 people have been identified for housing, and they're working with nonprofits right now on moving into housing. And when we say the goal is to house 400 plus people within 12 to 15 months, really, then that means we're going to push as hard as we can to actually get them housed as quickly as possible. So, Heather, if you want to add something from your perspective on that.
Sure, I'd be glad to. Thanks, Judy. And thanks to all of you for allowing us as head TA to be a part of this conversation tonight. So I understand the concerns around the cold weather and making sure that folks are where they need to be safe. What we know about winter shelter is the very best response is permanent housing, period, right? So we want Nashville to get to a place where your winter shelter efforts are no longer needed because you have enough permanent housing, right? So that folks don't have to be outside anymore. I wish that could happen overnight, that we could house 400 people tomorrow. That isn't possible. What is possible is that over the next 12 months that we will house 400 people. What we're doing right now is identifying the most vulnerable of the folks who are outside so that we get those folks into housing now, right? So the folks that are most at risk for COVID and a number of other things, right? Those are the folks that are going to go in first. And we will move down that list until we get as many people in as possible. But the goal is that the folks who may in the past have needed those winter shelter options because they are so vulnerable will be in housing and will not need that winter shelter option this winter. It doesn't mean there's not still going to be a need for that, maybe for some folks. The other piece that I know y'all are aware of is that shelter is hard for some folks and they're not going to choose to come into shelter. Those are generally the folks that are more vulnerable, but they are also folks that are not able or will not choose to be in a shelter for a number of reasons. Being in shelter is very hard. any of you have ever stayed in a shelter, but it is a challenging place to be. And if you are already in crisis for various reasons, coming into shelter, it can sometimes exacerbate that. So what we're doing is the outreach workers that are already there have been expanded. Judy said a little bit about the dollars that have come in for outreach. We are expanding. There is, Judy, correct me if I'm wrong, but I think it's a 4 to 5 person new outreach team. Yes. That is being coordinated by Park Center, that is doing intensive outreach for folks who are in the encampments to help us identify the most vulnerable, so that like right now, the second week in November, we have 70 people identified. Next week, we're going to have more people identified that are still, at the top of that priority list, to help those folks continue to move forward. I will say, and I hope all of you can hear this, is the providers in Nashville have really stepped up. The nonprofits have really stepped up to really expand their reach, to expand the ability of their staff and their capacity to really move toward permanent housing for folks. So it's been really wonderful to see that commitment from your nonprofits. It's really been inspiring, and they're working hard to move as many folks in as quickly as we can. The other piece of that, right, the balance of that is that we also want to do it sustainably, right? So we want folks who are working with them to have the capacity to do that well, to provide those supportive services that are needed and not overwhelm those case managers all at once, right? So it is a balancing act for the agencies as well. And we'll tweak that as we need to, right? As we move through the most intensive part of this is going to be the next 4 months, and then it'll start to taper off.
Okay. Thank you. One question from me, and then I'm going to call on my colleagues. My understanding is that part of the COVID money could actually be used to build or buy building, permanent housing that would be like a big place for different people. Is that part of the plan in this case, or are we just working with structures that are already in place, or is that part of the discussion in any way?
That's a great question. It actually is part of the discussion. It's not the emergency solutions grant dollars that Judy's been talking about, but you also have community development block grant dollars that have come in through the CARES Act. And I'm actually working with MDHA next week to have some conversations with nonprofit developers about acquisition and rehab for permanent housing for homeless populations, because that is an eligible activity for the community development block grant funds that you have. So we are working on exactly that possibility as well.
Thank you. Councilmember Hauser.
Yes, thank you. Have we ever explored the idea of the tiny house villages? I know I've read where in some cities, because I know you mentioned the challenges of being in a big shelter, that they've built these tiny house villages.
I don't know the answer to whether Nashville has explored that. The funding that you have right now would not do new construction. So that's not an option with the funding that HUD is putting out, because the HUD funding is for existing properties like acquisition and rehab. Often what we see that be used for is an older motel that can be converted, right, to 1-bedrooms, those kinds of pieces, those kinds of things. So I don't know if you all have explored that, but with the funding that you have available right now, that's not an eligible cost.
But is that anything that's on the drawing board to be considered in the future? Because we have our immediate situation, and then obviously this was a pre-COVID. We had this situation. It's just gotten worse with COVID because it seems like I know I'm in Bellevue, and we have this huge, one big encampment, then a bunch of small encampments that seem to be growing, and so. One of the things I was thinking, we've obviously have determined that the Greenway is not going to be public property anymore. And it looks like a perfect place to build a tiny house village, because if we're saying we can't use it as a park and it's not safe for people to walk down there anymore, why not surrender it and say, let's build a tiny village or something? And we also have the situation of not only the housing, but the behaviors. When one is homeless, it's part of survival. that really doesn't fit well with the rest of society. And I know we talk a lot about the housing, which obviously is the solution, but we don't seem to really address the fact about unacceptable borderline criminal behaviors. And I don't know if that's anything that y'all deal with or if that's a whole situation. Such as I'm in Bellevue, you think, okay, no homeless in Bellevue. Well, that's wrong. Just earlier this week, I was not home, but I understand that some homeless folks came into the middle of a river plantation and were threatening and screaming and throwing things, and people were literally shuttered inside their condos, afraid to go out. And when they called the police, it took 5 hours for the police to get here. So when those kinds of things happen, the compassion for homelessness goes away as people become afraid. And one of my concerns is not only addressing the homeless situation, but the fact that as this continues and escalates, we could end up having some citizens take the law into their own hands, and that would not be good for any of us. So I guess right now I'm experiencing a lot of frustration from my constituents regarding this.
I understand that, and that is a common feeling, I think, in places where encampments are visible. The very best thing we can do is get folks out of crisis, which means get them into housing. As folks are unhoused for prolonged periods of time, mental health, physical health, et cetera, deteriorates, and there are consequences for that everybody ends up dealing with, right? So all the behaviors that you're mentioning also are exhibited in housed folks. The majority of crimes that happen in any city are not committed by homeless folks, they're committed by people who are housed, and also in other kinds of crises, right? So the very best thing we can do is keep pushing toward more housing. Our hope is that this housing surge that we're doing with these dollars, and my guess is that some of the folks that are living outside near where you live, down in Bellevue, are going to be a part of the people that get prioritized because they're outside and they're known to the outreach workers. Is that the more of them we can get into housing, the less those behaviors will be evident because their crisis will be resolved and things will calm down.
And I want to add, that's kind of when we look at, the quicker we can identify people when they lose housing, and it's kind of this term of chronic homelessness. It's a specific definition. It's about the length of that people experience homelessness with a disabling condition, including mental health issues. And that's usually the population that you just described with where eventually you're going to see behavioral issues. So the quicker we have, that's kind of when we look at systems building. When you hear me talk about systems building, it's really the programs need to work together so we can interrupt the cycle of once people are on the streets, they remain on the streets. I also in the presentation have addressed the fact that Nashville has not really invested in individual homelessness when people didn't fit the youth or veterans definition. And that's kind of what we need to do. On the tiny homes, there have been, over the years, multiple interests and conversations, but it always, I'm not on the development end, and it always is a question of the affordable housing and the funding of the affordable housing. That has always been kind of the barrier. I am distinguishing very heavily between micro homes and just a shed on wheels, basically. We really need to build the community with it and the services with it, again, to disrupt that cycle. And those are the conversations. And frankly, we've had the conversations, council member, and you understand it. So I really appreciate your support and your continued conversation.
Councilmember Toombs.
Thank you, Chair. I have a couple of questions. One is, what type of assistance is available to folks who are already in hotel rooms, but they're struggling to pay to stay in the hotel room? And two, I see people who are not in encampments, but they're by themselves, they're on the corner or in whatever other location. am I to assume, because you said you've identified, I think, 2,000 people, am I to assume that you've identified that that person is out there on the street, or is there some type of number or something that I can give to that person? Because I have given my card to a few folks, and I've been able to help a few folks that way, because I hate seeing someone who's out on the streets and I do nothing. So I want to know, what can I do? How can I connect them to you?
Yes. One of the things is that's kind of where the street outreach, we need to improve the street outreach coordination that is happening. Where I need to fully be transparent is this year, my outreach team is not as solid because we are also helping out at the shelter. I have pretty much just a part-time person available who is then running after responding to complaints. And all we do, frankly, is shake our finger at people who know where the services are. So a lot of people that you encounter will know where the shelters are, they will not go there. So what my effort is working with these outreach teams that are forming right now, also with these additional funds, to see that we can set standards for outreach. So then that should include, and I'm looking at that, if it includes a phone line for the social services piece on the streets. That's what I actually, we have been talking about. That's one of the things I'm exploring, who then would, because when a line is set up, then there needs to be a response to it very quickly because the person will move. So I'm glad you actually bring that up because it cements that thought in my head that, yes, that's something that we need to look at, pursue. I've started to explore what other cities are doing in that. I also had conversations talking about the street outreach effort with Interim Chief Drake on how partnerships and what police partnerships look like. He's extremely interested in how to partner with social services around homelessness so that it's not, arrests are not doing anything. So what can police departments do? And he's very open for this conversation. And that's where all of that is heading as well.
So is there a list of the nonprofit organizations that are providing assistance? Because my other question was about the folks who are already, they've gotten into a hotel room but can't really afford to stay there. They're struggling to pay the rate.
Yes. There is one resource guide that is called Where to Turn in Nashville. I will send out a link. It's online as well. It's published by Open Table Nashville. It lists all the nonprofit organizations that provide services. For any prevention or rent assistance, I just looked at, it's a really comprehensive site. And United Way has a list of where those services are, where people can go for assistance. It includes Metro Action Commission and Rooftop and other organizations like Needlink and what is out there.
Thank you. Councilmember Toombs, is that it?
That is, thank you.
Thank you. Councilmember Hauser, your hand is still up. Do you have a follow-up question?
Sorry, I forgot to take it down.
Thank you. I don't see any other hand up, but Miss Anna Davis is here. I guess my question is, as we're working with people that are in a campaign and we're looking at long-term solutions to be able, we know this is going to take some time. Obviously, we're not going to be able to move all of them. And so would you be able to share with us, and I don't know if you do know that part of it or not, but or if any of you knows what's happening with the people that are not going to be able to make it into a house, are we getting them to the shelter, and what is our cold weather response looking like for this year? While we're at it, and David, I'll let you answer that, and then I see Councilmember Rosenberg's hand up. Councilmember Rosenberg, do you want to ask your question, or do you want to wait till that is responded to?
Thank you, Madam Chair. I'm happy to wait.
Okay, all right.
Okay, so this year we have as I said, this website that I listed, coldweathernashville.com, if you can always go on there, it lists when the Metro's cold weather overflow shelter is open. So at 28 degrees, and it's we're monitoring the weather every day. If it's forecast for the next night to be 28 degrees, we're alerting all nonprofit partners and outreach workers that the cold weather shelter at Metro will be open, that overflow shelter. This year it's going to be at the fairgrounds. It's a separate building adjacent to the existing sheltering operation. It is with immediate access. It has way more capacity than last year's facility, which is why we chose it there. And it's also the immediate access still looks at people come in and are checked for their symptoms as they enter. If somebody has a symptom, there is the facility right next door where they can go into isolation and then be tested at the next day and wait there for test results. So there's a process set up. People will have be provided food. It's for individuals, men, women, it's couples, people with pets. It's really a very low barrier shelter. It's open from 7 p.m. to 7 a.m. And it's pretty much the same operation as last year from operational. If you have any more detailed questions, please let me know. Happy to answer that as well. Yeah.
Thank you. Councilman Rosenberg.
Thank you very much, Madam Chair, and thank you all for being here and for the incredible work that you're doing with the minuscule fraction of the resources that you should have. Judith, I was hoping that you could just, since we're being recorded and I have a chance to give if you wouldn't mind just giving an update on the latest of Charlotte so I can share that with constituents.
Yes. So that's called either the Lowe's encampment, it's Brookmead encampment. It's right behind the Bojangles at Charlotte, around that greenway. There have been Water Services is doing constructions there for 2 years. So the last, I think it was in September that the construction agency started. So some people have moved, but it's a large property. There's still about 40 to 45 people there. It has been, actually, there have been more people over summer than there are right now. So services that are happening out there, there is one outreach provider who also is going to get some ESG dollars and able to expand their outreach in that area and linking people to housing. So they're looking at making sure that people are in our system and on the wait list and for the prioritization. And then there are health services that are going out there. I actually checked in this neighborhood health last night. They're looking at the larger encampments. This is one of the 3 largest encampments in town. And they're providing COVID tests. They're doing flu shots and pneumonia shots in encampments just to make sure people are safe. I asked for their rate of positive results. And in the encampments right now, it's been very low. 3 or 4 people overall. So knock on wood. But if somebody is very sick, they may just go to the hospital very quickly and then have access to the fairgrounds isolation if they don't need to be hospitalized. That's how it's handled, how Metro is kind of working with that. Neighborhood health is partnering closely with the health department and really doing outreach in the streets to provide services.
Thank you. So that what you just said just kind of hit me. Are we seeing more homeless folks around Bellevue because they're less comfortably able to be at that encampment?
If so, it will be 5 or 10 based on the numbers, but then also I'm trying to take the pulse based on just doing surveys with outreach workers, what they see all over Davidson County. And I just did that in anticipation of this presentation. And since June, basically I calculated based on anecdotal observational data. So, don't hold me to it. but just a 5% increase. I don't see that anybody is, when I individually ask them, telling me that the numbers are shooting up. But the fear for me is really what's happening if the COVID dollars are drying up at the end of the year. What we're going to see then. Also, frankly, it's going back to when people don't have access to the services that they usually have. So you're going to see them more in the streets than usually during the day they would be somewhere inside. So yes, from that perspective, I think COVID has really made homelessness more visible and just more in the community. And the behavioral issues have increased due to stress and mental health issues.
And I'm going to add a little bit to that, Judy, that I think is useful to put Nashville in the context of, the work that we work across the country, right? And so what we're also seeing is as we decompress shelters, and in Nashville, the rescue mission is your biggest shelter, and as that has had to be decompressed, some of those folks have gone to the fairgrounds, but not everybody, right? So what we are seeing across the country is that folks who may have been in shelter before do not feel safe in shelter because of COVID and are choosing to be inside. And unfortunately, the reality is that is safer than being in shelter for COVID, right? It doesn't mean it doesn't exacerbate other things, but that is the reality, right? And so we're in the toughest spot we've ever been in trying to solve this with additional housing, because shelters aren't safe the way they used to be. And they've never been safe for everybody for a variety of reasons. Now they're even less safe. So we are seeing across the country is that the unsheltered numbers are up, but your overall homelessness numbers are not, which is also true in Nashville, right? So Nashville's overall numbers haven't gone up, but your unsheltered number has gone up.
And I'm actually so glad you said that, because I don't know, I actually looked this up this afternoon, and about half of the population that we're having are on the streets or in encampments right now. And usually I would say it's been about tops a third. And even that is kind of, when you look at it's high when you look at, the ratio. But yeah, that's absolutely true. I just looked that up. Yes. It's about half of the population that is on the streets and shelters, that, a lot of that portion would be in shelters otherwise.
Councilmember Rosenberg?
That's fascinating. Thank you so much. Thank you very much for the info.
I will add one more. Councilmember Rosenberg, I just wanted to address one more thing and give a shout out to our Metro Police, that as the great work of Heather and Judy is helping to house people, we know that there's a lot of debris that gets left behind and trash. And so MMPD just hosted a big cleanup effort in partnership with Public Works and a couple other departments to clear out one of the other encampments, and obviously not moving people's belongings, but really working with anyone who's living at the encampment to clear out any trash and just try to increase the quality of life for the neighbors or anyone coming to the park. And so we're looking to do something similar with the West Precinct out at Brookmead, and taking the learnings that we had from the downtown precinct. So that will be in conjunction once the residents are moving out, that we will also make sure to try to rehab what's been left behind for that, especially that park usage.
Thank you. I know that Councilmember Hauser spoke about Bellevue and Councilmember Rosenberg talked about Charlotte. I guess the one that everyone has been emailing about, and if you would talk about what's happening there, is the Jefferson Street. Judith, would you speak to that?
Yes. That's one in September we had effort, brought a lot of organizations together to do a service effort there and making sure that they are all on the prioritization list, like in that those tools that we are using to prioritize. So that has happened. then the Salvation Army has really increased their outreach since the beginning of COVID. They have actually not traditionally done a lot of outreach, but have really beefed up that effort. And Jefferson Street Bridge is very high on their list. I have been in touch with, there's also mental health services that we're bringing in. The issue there, that is an encampment that I'm super concerned about. If we were, we just need to really focus on the housing pieces, what we can do, and see how it all, how it all distributes right now, and if we see movement in the next couple of weeks from people down there. I have also urged and tried to find locations or faith-based communities just to see if there will be somebody willing for offer smaller shelter, because they are not going to the large shelters. They know where they are because we've tried that. They're not moving there. So that's kind of, and then with congregations and churches right now, they're struggling. They're not having their services, and I think there are some legal issues why they're not, being able to do their usual services. Room in the Inn, for example, through the cold weather, they usually have 200 congregations that work with them through the winter shelter program. This year, it's just a very, very low participation rate from congregations because of COVID. So that's just where we're stuck. We really, I'm feeling the desperation there, and we just need to focus on the housing and the services and continue all of that effort.
My understanding too, Judy, from our last meeting is that some of the folks we've identified in this first high vulnerable some of those folks are in that encampment.
Councilmember Porterfield.
Thank you so much, Chair. I'm sorry, I was having a hard time unmuting. My question is a little bit similar to Councilmember Toombs' question earlier, but just taking it one additional step. A lot of our constituents will reach out and say that they've seen unhoused individuals in the community, and they have concerns about what they should or should not be doing to try to help support them. And I know that, they may not have that resource book to share with individuals as they're coming across unhoused people in our community. So what should the community be doing as they're coming across individuals? How can they help support? We get a lot of concerns sometimes about panhandling and aggressive panhandling. And, there are some people that are genuinely concerned about the well-being of the individuals. And then some people are concerned about what they perceive to be happening with their community when they are encountering individuals. So what should our communities be doing?
And one of the things that I don't know how to formulate it, because it's not, there is not the quick solution where I can say, here's where you go and then they get housing. But one of the things when I engage with neighbors and talk about it, I look at what are the services in that community, who is in that community. So, a lot of times it's a church that has taken some leadership around homelessness, and just connecting the people to that service to help volunteer there and support what they're doing. And the other thing is ask the person's name, get to know the person. But it's also, that's up to the individual how comfortable they are with that. But if they really want to help, I think it's helping building that community, helping with that. I also have talked to people that have built relationships with people experiencing homelessness, and then they call me and somebody may be willing to work with the service, and then we can link them to service quicker and more effectively. So it seems simple, but it really is about, let's see what the person needs and wants in a moment to help build that relationship, give them hope. A lot of times it's that hopelessness that lets people act out and not access the services that are available. And so maybe that's if somebody's comfortable to doing that. Or the other thing is just get involved with a nonprofit or with a church that, especially in that neighborhood, has some of the leadership and works with the homeless community.
Thank you so much. One thing that I think that I want to take away from this, and I want to encourage Judith, is that phone line that you're talking about. I think it would help a lot. I think if there's a dedicated number that if I see someone on the street, I can say, call this number, somebody will help you. I think you can do that at the not necessarily call somebody to come and pick them up or to come and, but maybe even just to give them a number to say, here's a number to call where you can actually get help. That's something that all of us can do. We know we have unsheltered people in encampments, but what about the ones we just see under the bridge today and then they're not there tomorrow, and they may not know where to go. And I think if we can have that kind of hotline or phone number that can be manned, that can, even if it's a voicemail that we say, based on your location, something that we can actually do immediately. I think that's something that I think we should work on. I think that would help a lot as people are coming into this situation. I will also ask, if you don't mind, if you will please share that presentation with us, as well as the link to those resources. And I'm encouraging my colleagues to share this information out as well in your newsletters, on your social media, of the resources that are out there. We know that this is a very tough year, and because of COVID, like you said, people usually go waiting rooms and in churches, and they're not able to do that anymore. And so we're seeing a whole lot, and hopefully maybe just having that information out there, we will be able to do more. I'm still interested in the cold weather effort. I'll go look at that some more. And if we need someone to come and speak to that, we may have somebody come back and talk specifically about that, because that's something that we need now. And the people that we're not able to house, we still need to be able to get them to a shelter or find them a place. Ultimately, that's what we want to do. So, Ms. Tackett, I see that you raised your hand.
Yeah,
you're recognized.
Yes. I do have also an ask. First of all, I really appreciate every single one of you to pay attention to this issue. And my ask is, please continue paying attention. Please feel free to reach out to me with questions. You don't have to wait for a presentation. I'm here for you. And please help me think through sustainability. We have these $10 million that have to be spent, and it's one-time funding, and they have to be spent by September 2020. We need a plan. What are we doing after to sustain what we're doing, to increase what we're doing, when this works, when we see how this works. We're going to see how this works for people, then it's kind of, how can we replicate it? How can we improve it and build that system and continue? And I cannot do it alone. I need your help. I need the Metro Council.
Well, thank you. I want to look and see if there's anyone else. I don't see any more. And thank you all for being with us this Friday night. Like Ms. Judy said, email our question if you have any. Thank you, Ms. Tackett, Ms. Dellashaw, and Ms. Davis. Thank you for the great work that you're doing. And thanks for being with us. And colleagues, thank you all for all that you're doing. And thanks for being at the meeting. With that, 6:02, this special committee meeting will now be adjourned. Thank you all so much. You all have a nice weekend.
Thank you.
Bye-bye.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.